line is taking long enough already. There we go. Wilson, bag.
Good afternoon. If you would place your baggage on the scale while I check your passports. Sir, Mr. House.
That's Dr. House to you.
Your bag is several kilos overweight.
Is that all your paid minimum wage?
House, calm down. We can sort this out quietly. I apologize for my colleague's behavior. Hey!
She's having a stroke.
Call an ambulance!
House, why is it that everyone you yell at ends up having a stroke?
What do we have here?
House, we have no reason to stay and solve this case. We might miss our flight.
Just book another one.
Must you waste all our hospital money?
Symptoms are stroke, and stroke, people. Go.
House, you need to forget about this case. Go back to New Jersey.
You're missing the point. We have a patient and we need to treat her. Ideas, please.
Stroke usually means a brain infection. It's usually meningitis.
You would say that, Foreman. You're a neurologist. Next.
Could be a brain aneurysm caused by hypertension.
Wrong again. Go find a new job as a naturopath. Next. The patient's got to have more than a stroke. Maybe it's just a case of too many blood thinners. At least you're thinking, but no, still wrong. Next.
House, stop playing quiz games with patients' lives. You know the answer.
I was just testing to see if someone would notice that.
Perhaps it's autoimmune.
Can't be. The white count's too high. We haven't done a white count yet. Or the white count you're going to do will say that it's too high for it to be autoimmune.
White blood count's normal.
How did you get a result in less than 30 seconds?
It's an ambulance.
So I told you, it's not lupus. What else could it be? Maybe Foreman's first guess was right. But it's not meningitis. It's something like blastomycosis. Chase, test the blood for hepatitis. Test is negative.
Maybe she has cancer. Maybe a brain tumor.
Once again, just what a neurologist would say. Now, if Cameron had suggested it...
House, alright, it's a brain tumor.
It could also be a fast-acting botulism. Okay, do a brain biopsy to test for cancer.
House, run a moving vehicle. Cutting her brain open could kill her.
But we need to give her the right treatment. If we give her the wrong one, she's gonna die.
Alright, do the biopsy.
I don't see anything. What?
No brain tumors, but constricted blood flow. So the lack of the blood to the brain caused the sudden stroke symptoms?
So it's not botulism and it's not a brain tumor. Foreman, Chase, search the house.
Where is that?
19 Church Street, apparently. Wilson, get the ambulance driver to stop and drop off Foreman and Chase.
Can we stop at Church Street, please?
Well, I guess we'll be waiting now.
Unless you have a better idea. I have one. Let's do open heart surgery to pass the time. Open heart surgery to pass the time. Cuddy?
Do whatever you think is best.
I'll just make the incision. First incision. Second layer, dural matter.
Ah, the IV! It's moving so fast!
Quickly. Before the patient crashes. Now.
Oh my god, it's a femur. Remove the femur. Ah!
Pass it. Just stick it on the shelf over here. Keep doing surgery.
Let's close her up.
Yeah, I don't... She's clean.
Why is so interested in this case? It seemed perfectly routine to me.
Perhaps he sees something we don't. Let's check upstairs. This floor is pretty much clear.
Wow.
Wow is right. Some old cleaners here. Nothing too out of the ordinary. Perhaps he's up to something. Perhaps the patient knows something and has some connection to House. Wait, my phone's ringing. Yeah, House, what is it?
So you sent us to the wrong Church Street, but so far the house looks clean.
Wait, I think I see something.
What is it?
It's a book.
Michael Ignatieff.
Empire Light by Michael Ignatieff. She reads Ignatieff?
How much money?
What do you mean?
Yeah,
I mean,
this is freaking out a lot here.
it means the problem could be in her brain after all.
But we already ruled out infection.
We ruled out bacterial, viral, and now fungal infections. But a parasite could be affecting her brain. A parasite could have caused sudden nerve damage leading to cardiac arrhythmia, leading to hypertension, leading to a brain hemorrhage, leading to a stroke. House, what is it? Parasites cause the stroke. Do a PCR to confirm and give her pyrimethamine to solve the parasites. House, pick up. Are you there?
House?
House, what's happened, House? Let's go.
House, what is it?
Have you noticed the driving getting more erratic?
We've been making sharper turns, but that doesn't mean anything.
I think the ambulance has been hijacked.
Don't be ridiculous, House.
Call Wilson.
Wilson? Wilson, pick up! It's an emergency!
She's flatlining.
Someone get the paddles!
Clear. Clear. It's not a parasite.
We need to intubate.
So what causes stroke, hypertension, cardiac arrest, seizures, and respiratory failure?
House, if we want to make our flight, we should start planning our escape, not our diagnosis.
Well, we can't call Foreman and Chase. Our cell phones are jammed. This should get their attention.
If you want to see your oncologist again, you will stop banging and cooperate.
You'll have to do exactly what I say.
You have Wilson? What do you want?
Wilson's alive?
Like I tell you, let's just say it's vitally important that you do not get back to the airport until after the plane departs. Oh, and the patient is in on it.
So the cardiac arrest and stroke were part of the plan?
No, you weren't supposed to suspect a thing.
But we still need to explain the other symptoms.
Wait a minute, so you say the patient was in on it?
This conversation is over. Stay nice and quiet in the back.
What are you going to do?
Just watch me.
House, no!
Good job, Wilson. Foreman, Chase, what's going on? Where are you guys?
House?
House?
House, where are you? We haven't been able to reach you.
Dispatch says you just dropped off the radar. Just get over here before we all get...
What?
Stockholm Syndrome. It's syndrome. It fits.
How?
Stockholm Syndrome caused the hypertension, and the femur and the heart caused everything else. Foreman, quick, get over here. I think the ambulance is about to crash. Wilson, are you alright?
Much better now that you've arrived, Chase.
Now let's get to that hospital.
One of these days, House, you're gonna get someone killed.
Let's go home.